Cruising through Sandestin. What a beautiful area. Picking up my customer, dropping them off, and I'm done for the day. It's my first video back from the accident, and I'm feeling pretty good. I'm still suffering from unbelievable mouth sores from a reaction from one of the 9 medications they put me on. Oh my God, you want to drive a man to his knees? Give him mouth sores. It's unbearable. My tongue is like 3 times the size, swollen, bumps all over it, canker sores on just my whole mouth is infected. So something with the reaction of medicines, that if you mix them, that's what happens. You get very yeasty, and I'm yeasty. Ugh. Anyway, my buddy Mike's coming over. We're gonna do this needling thing and see if we can get some relief in my back. I think that's gonna be a fun segment.
Okay, I am going to check on our patient. I'm calling him the patient because he's still struggling. It's been almost a month. Let's go see. He is waiting for our friend. Hi.
Hey, is Mike here yet?
No, let's go inside and wait for this. Should be here any second. And Mike is our friend who's a
Yeah, he's gonna do dry needling on my back. So
Yeah.
we're gonna try that.
Because from this accident, it has just snowballed from one thing to another with you.
We're not supposed to talk about the accident.
Oh, anyway, you're still
But
struggling.
I got sores in my mouth. It's just,
It went from
bad
A
to
B
worse.
to C to D. Yeah, everything. So anyway, he said your nervous system is so whacked that he's
Shot.
gonna try to do some dry needling, see if it helps.
Yeah, everyone says that's, I don't even know what dry needling is, but we'll find out.
You might get a little like kind of dizzy, lightheaded, things like that. Not common, but it can happen. So if you do have any of that, just let me know, okay?
All right, so this is Mike. So Mike, so other than dry needling, what's the actual like scientific term? And
So it's called dry needling. You can do a lot of different things with it. Usually it can be used to kind of release some muscle tension, kind of just help muscles activate a little bit better. But the kind that we're going to be doing today for Patrick is designed to kind of calm down a hyperactive sympathetic nervous system. So we're going to kind of go up into the suboccipital area, and we're going to work our way down the thoracic spine here. Basically kind of going along the spinal cord a little bit. And what the needles kind of do is kind of just reset everything in that area. It kind of just helps take areas that are just kind of all out of whack and just hyper fired and get them to relax a little. So we're going to start off up in here.
And this also, because he had whiplash and he never really got anything done for that, so this will really help that too.
Yeah, definitely. All right, ready? 1, 2, 3.
You feel that, honey?
Yeah, a little nothing, but.
Yeah, it's the needles. Honestly, the needles are so thin and small, you don't really feel too much. If anything, you'll get like a little kind of like crampy feeling. As we get into some of these muscles, you might feel it a little bit more so.
And then you said these stay in for about 10 minutes?
Yeah, once they're all set up and stuff, we'll probably leave them in for about 10 minutes. Usually I'll kind of go for about 5 of just letting them go. And then we'll do a little kind of twisting to make sure that they're still kind of grabbing onto the nervous system areas. And
Is
then
this the same thing as like acupuncture?
so it looks the same, uses the same needles, but different in technique. Where acupuncture goes along what they call those like energy lines.
Okay.
This is going more along the nervous system pathway or the muscular pathway.
Okay.
So acupuncture also stays pretty superficial, meaning it's not going to go very deep into the muscle, where dry needling is actually going to kind of go, you all right?
Oh,
Yeah.
I could jerk on that one.
Where dry needling actually goes deeper into the muscle belly.
Mary, do you get close up?
Yes.
Right inside there,
Yeah. And so my son, who used to do CrossFit and had a lot of muscle stuff, he had this done. Do athletes get this done a lot for muscle recovery?
Yeah, I would say the more common rationale for getting dry needling done is going to be for like kind of muscle issues.
Yeah.
Along the nervous system is definitely something there's a lot of research for, but I would say not quite as common.
Okay.
I'm going to get all the left side first. 1, 2, 3. All right.
Yeah.
And then we just kind of do a little angle this way, where dry needling is a very safe technique if you know what you're doing. But one of the areas that if you're not certified or rushing or things like that, that you can cause some issues is if you go too deep into the lungs, and then you can cause a pneumothorax, which obviously we don't want to do. So that's why we just angle it this way,
Wow.
so we're nowhere near the lung field.
And speaking of pain, Mike, how are your knees feeling?
I'm doing
On
fine.
the brick, on the brick papers. You wanna
I'm
show
doing
them?
fine.
Are you kneeling on the
Yes, he's kneeling on the
Mike.
brick.
Here, get him a towel.
No, we're good. I'm fine.
Oh.
Honestly, we just went for a walk, and I think all I feel right now is just the heat of the Florida sun.
Oh. It's hot. How you feeling so far, honey?
Good.
Yeah.
Yeah, pretty painless, wouldn't you say?
Yeah, it's a half a bee sting is what I'd say.
Yeah, there's certain areas that tend to be a little bit more kind of like tender. This one is not too bad. If I get up into your upper traps, then we'll see. That one can be
Yeah.
a little bit more uncomfortable.
And in your practice, do you do this often with people that were in car accidents and stuff similar to what Patrick experienced?
Yeah, I definitely do it more for like the soft tissue release, I would say. But I do, if I have people who have had a lot of like hyperactive nervous system, a lot of people who have like vertigo and things like that can respond really well to dry
he's got
needling.
that too.
Well, there you go.
So there you go, honey. Maybe it'll help your vertigo.
Hanging in there.
Oh yeah. I'm great.
Okay. And how do you know, or when do you know, when he really will feel some relief from it? Like, what do your patients normally say?
So a lot of times you can get some relatively immediate relief. And then as kind of like blood flow, like one of the other things that dry needling does is going to promote a lot of blood flow into the area. So a lot of times you can kind of get a little bit of an immediate relief from the nervous system response. But then as blood flow kind of continues to return over the next couple of like hours, you can kind of see a little bit more. But realistically, when I'm doing this like in practice, it'll normally take like a couple of sessions of needling. So we'll see how the one time for him feels.
Okay.
I'm hoping it can at least calm a little bit of the nervous system symptoms he's been having.
Oh, I see your scar too here, honey, from your cancer cutout, your skin biopsy. You're a hot mess, honey.
Feel okay?
Yeah.
All right.
Like I said, it's a half a bee sting. Like it's nothing.
Yeah. Yeah, it's honestly worse when you go into the muscle, because that's when you can kind of get some nice little spasms in people.
That would be me.
It kind of freaks them out a little. Yeah,
You said
your
you-
right side is definitely a lot tighter. That's one of the other nice things about the needles. Because they're like metal, they kind of have a little bit of like feedback. So I can really feel the kind of the resistance that the soft tissue is giving.
So cool. It's my first time ever with any of this kind of stuff.
And this kind of falls under like holistic kind of healing.
Everyone who sees it always thinks that it's just based off of acupuncture,
Yeah.
which it is actually not, ironically enough. So dry needling started because there was a physician who was trying to get rid of trigger points in the body. And so he was experimenting, right?
Yeah, that's a little cracky.
He was experimenting with injecting lidocaine into trigger points. And then he started seeing that the muscles were releasing before they actually did any of the injection. So he started experimenting with thinner and thinner needles, and then kind of realized that it was actually just the needle effect more than just any injection that was kind of releasing and resetting the muscle.
Oh, interesting.
So even though it looks very, very similar, it actually is not based off of
Okay.
Eastern medicine. Okay. How's it feel?
I'm good.
Easy peasy?
I have that one that has a little cramping, but
Yeah.
Just like you said, everything you said is exactly the way it happened.
All right. Now I can. You want to do one of the ones into the muscle just to kind of feel it?
I'll do whatever you say, yeah.
All right. This one might be a little more uncomfortable, FYI. We'll see. Sometimes you get a nice little muscle spasm with this one, which will look good for your camera. Yep.
And that was, oh yeah.
You see that kind of muscle twitch?
Oh yeah. And this is the side, ooh,
There we
that
go.
that he got hit on was his left side. Is that strange that he got hit in the left? You said his right side's more tight. Is that because like the right side overcompensates for that impact
Honestly,
on
that
the
could be. He might have just been tighter for like even prior to the accident.
Yeah.
Right?
Yeah.
Feel that, honey? Yeah.
Okay. There you go.
All right.
All right.
So-
On the clock for 5 minutes, and then we're going to twist them. Like, there's only a few contraindications. One would be like if you had a severe like metal allergy, obviously because you're putting metal into the body, so
Yeah.
you wouldn't want to do that. Pregnancy is not necessarily a contraindication, but it's a precaution. There's some people out there who will say that if you hit a certain trigger point that it can like lead to miscarriage. There's not really any evidence behind it, but it's one of those not really worth the risk kind of situations. But the biggest contraindication to it is if someone is got a very big phobia of needles, or if they're just like, pass out when they give blood, those type of things. Because you can't get that sympathetic response, and if someone's not able to relax, then the needles won't do what they're supposed to do.
Right.
So like one of the first things I would ask when I'm doing needling on someone is like, are you okay with needles? Do you pass out if you give blood? Like, do you get lightheaded when you've gotten like an injection or anything like that? And honestly, just some people are just like a little bit off. I wouldn't needle that person if I don't like trust that they're going to be able to like emotionally handle it.
Yeah.
Like even one of the guys that I work with, he goes in and teaches dry needling courses. So he like helps people get certified in it. And he was saying that like every course he's ever done, there's always a couple of people who end up just like having like really big like emotional reactions. Like they'll just like do the needling and just like start like bawling. And they're like, I don't really know why I'm crying, but I am.
So this is a twisting, you were saying.
That's cramping up there.
Yep. And so we just kind of do like a little pistoning and just a little twist to make sure it's kind of grabbing on. Yep, there you go.
Got my attention. So what is that? Like just a natural muscle, like freaking? Like now I'm starting to feel crampy on both sides.
Yeah, because I'm actually kind of pistoning them in a little bit more, moving them around a little bit.
He's
I didn't know
twisting
that.
them.
And then we kind of twist it, so it kind of just makes sure that it's grabbing on.
So I just felt more pressure, but I didn't feel any twist or.
Okay?
Yeah, it's a little pressure.
Okay. Yep. And now we'll kind of go...
Crampy type pressure.
Yeah, we'll let it go another 5 minutes. But that's like the thing, is if you put it like in an area that's not kind of like out of whack, you don't really feel much, you know? It's not until you kind of hit those like areas where the muscle or the nervous system is kind of locked up that you kind of get that symptom. So I always tell people like, if you do get those little muscle spasms, or if you are feeling like, ooh, like this is definitely replicating some of my symptoms, it's normally a good indicator that this is kind of like doing what it's supposed to be doing.
Really? Okay.
Like if we just put it in and like you weren't really feeling, like if I put it in like a muscle that wasn't jammed up, like you probably wouldn't feel that much of anything.
And just, I feel like I'm working out on that muscle. It's like
Correct.
It's a little crampy. It's a little bit like I'm working out.
And there's a good chance that later today, even tomorrow, that you're going to feel like you had like a really big like workout in the back.
Really?
Because it like what it should be doing is kind of releasing a lot of those areas like we talked about, right? So a lot of that is going to have like a waste material that's just been stuck in there for a long time because there's like sections of the muscle and nervous system that are just all out of whack. So as that takes time to release into the body, it takes about 24 to 48 hours for the body to just recycle that waste material out. So very similar to like after a workout where you're like really sore because you've got like a little bit more of a lactic acid buildup. That's kind of what's happening here. It's just not from a mechanical breakdown. It's because of all the waste material that's been stuck in there.
Gotcha.
Okay. That's a good explanation.
You ready, Mary?
Yeah.
It's my homemade Sharps container.
It's a Sprite can.
Oh, is it?
Yeah.
I can hear some kind of tin, but I didn't. Yeah.
In clinic, we have fancier ones.
Oh, I love that we're doing this poolside.
Yeah, not a bad way to get some therapy, huh?
Yeah.
Oh, this is the way to go. Beats being in the office with the fluorescent lights, right?
That's right.
Those are in there pretty deep, like an inch maybe?
Mm-hmm.
Are they really?
As you can
Yeah.
see, so that's about that deep in there.
Yeah. So
Certainly don't feel
These
like
are 50 millimeter needles.
I can't believe that. It felt like a half a bee sting. That's the best way to describe it.
Yeah, the needle itself is so thin, you don't really feel too much. It's really more when the muscle grabs around it. You get kind of that like achy. Someone described it once as like a very localized like Charlie horse, and I feel like that's kind of accurate.
Yeah, that's a great way to describe it.
All right. And
okay.
make sure they're all out. They're good.
How's it feel?
Good.
Yeah.
Yeah.
Okay.
I'm dying to see how tomorrow is. With
Yeah.
that tension and that feeling you feel like you're working out, it's got to be doing some work in there.
Mhm.
That's just, I think that's proof right there that this works.
Yeah.
But we'll know tomorrow.
Yeah.
Right?
All right.
Is it tomorrow?
I mean, I wouldn't be horribly shocked if hopefully you feel like a little bit better over the course of the day.
I have to say it's 24 hours now since Mike did the dry needling. And I do feel looser. I feel much better. The two, he said what they're called. I call them the two pipes that go up the back of your neck to your head, the muscles. They've been just locked up tight. Everything's kind of loose. I think it really was good. I think I'm going to do it again. And I hope Mike explained it all. I think he did a really good job of explaining what dry needling is. So it's a little different than acupuncture and actually quite a bit different. But I'm kind of a believer. I feel pretty loose now and I'm going back. I want to do a second session with Mike. So we're going to see them tonight. He lives in our building. He's just a terrific guy. He's been talking to me about what he does, his practice for a long time. And he's always said, I'll bring home some needles and we'll try it on you. And I'm that kind of guy. So we tried it. Anyway, I am going thumbs up on it. I'm going to review a lot of stuff. I've like the hydrogenated water. I don't think, I don't know. I don't see any results in it. Like I'm drinking it and I'm kind of losing interest. The other stuff I've done, methylene blue, I took that. Okay, that works. Don't take that unless you're ready to reorganize your garage or get a bunch of stuff done because it kind of scared me a little bit. I mean, it is blue dye you're ingesting, and it you know, it doesn't feel right. It feels like you're ingesting blue dye, but it does great things to your mind. It's been around for 100 years, and they've been treating people with it, brain injuries. So I think it's right up my alley. It was a perfect time to start trying it. And I'm only a month in on trying that, and I actually stopped since all this injury stuff and this infection in my mouth. I've stopped everything. I stopped taking all that medicine because that's what's causing this. So anyway, my hat's off to Mike. Thank you again for your great work. And I definitely feel loosened up. And I have a little soreness right here, but that's where he did that deep. He did the one needle real deep into the muscle. So I'm a believer.